Let's discuss the latest now on the pandemic in more detail. Joining me now is Dr. Chaand Nagpaul. He's chair of the British Medical Association. Also joining us, Professor Melinda Mills, Professor of Demographic Science, also sits on the SAGE Group for Behavioural Insights, and Dr. Bharat Pankhania, Senior Clinical Lecturer at Oxford University. Thanks very much, all of you, for joining us. We've been asking people on Twitter and on our websites to get in touch with us with their questions. Lots of people have questions, Dr. Nagpaul, about the dates of various boosters and things that they may have had in the past. But let's start with Dr. Bharat Pankhania. One question has come in from Sean on Twitter. He says, why are we not testing for antibodies routinely? Wouldn't this help us ascertain immunity in the population?
Yeah, Sean, the short answer is that measuring antibodies is a imprecise science. And if you think about it, Sean, we've also got to take a needle, a syringe to your arm, take some blood out, send the blood to the laboratory, get it analyzed. So it is a long, tortuous process to look for antibodies. It's expensive. And furthermore, the test for the antibodies is not precise enough for us to say, I see antibodies, therefore you are immune.
Right, so it's not very efficient and it's not very precise. Pretty clear answer there. Let's move along the line to Professor Melinda Mills, a demographic scientist and also behavioural expert. Another question, is it good public health policy to force people to be vaccinated or face restrictions and discrimination, both socially and medically? So clearly coming from a political angle, but in more general terms, does it work, good public health policy, if restrictions are implemented? Do people tend to stick to them?
Yeah, so the question is about whether, mandatory vaccines would be brought in, and that has been discussed in some countries such as Austria and Germany, but that hasn't been the discussion here. So because generally, other things like incentives can be more effective in, in people understanding why they need to be vaccinated and how it works, because really we have this large middle group, and some people aren't vaccinated because they still have some safety concerns and they want to discuss it more, and that's why we should have more dialogue. And there's just a very small group that is actually against it for other reasons, often non-medical. So, things can work such as, sending reminders to people, making it convenient, having longer opening times. And we're really experiencing that now that, when the Prime Minister gave the announcement on Sunday, you had this rush of people actually wanting to have the vaccines. And as you were just discussing, there's people around the world that are really, desperately wanting to have these vaccinations. So I think in general, the public has really adhered and has really listened to these things. And as we enter into the winter period, they're understanding, why they have to wear face coverings, why vaccinations are important. So we can anticipate the similar amount of adherence, I would think.
Dr. Chaand Nagpaul, Lauren has written in. She says, is there any known difference with catching the Omicron variant during pregnancy? I'm double jabbed, not yet, though, in the window for a booster. Should there be any further guidance for those who are pregnant?
Well, the Omicron variant has only come to light very recently, and I haven't come across any government guidance that is specifically about Omicron. What I would say is that because we know that pregnant women are at higher risk of complications or severity of illness, what should be done is to take extra precautions not to put yourself at risk if you're not yet eligible for the booster. What that means is that the measures around physical distancing, not mixing in crowds, and what we at the BMA are promoting is that the public, and especially pregnant women and others who are vulnerable, should be wearing FFP2 masks. These are higher grade masks that protect the wearer as well as preventing transmission to others. So those in higher risks should be wearing, in our view, higher grade masks. They're readily available from any high street pharmacy, readily available online as well.
OK, good advice. We've just heard some breaking news that the Shadow Chancellor, Rachel Reeves, has tested positive for COVID-19. Dr. Pankhania, of course, the day is the day that the regulations change, don't they? If you've come into contact with somebody who has COVID-19, you don't have to now self-isolate. You can do daily lateral flow tests. Is that a concern for you in terms of the spread of the new variant and the old variant? Do you think numbers will go up because the regulations have changed?
Yes, I do. And this makes my job as an infectious disease expert difficult, very difficult, because we all know that the lateral flow devices are not accurate. There are two issues here. One, the accuracy per se, and the second bit is how well did you do the test? And I'm often in outbreak control meetings saying, unless and until you do a really good sample taking, then your test is meaningless. So with respect to lateral flow tests of contacts on a daily basis, it is a flawed process. The flaw being you can game it. Nobody's checking, nobody's scrutinizing whether, number one, you really did the test. Number two, did you do it properly? And number three, we know inherently that the lateral flow devices have an inbuilt inaccuracy.
However, I suppose, Dr. Pankania, you could say that those who are self-isolating for 10 days could also game the system, couldn't they? They are not being checked every day throughout that 10-day period, so we are going on trust, aren't we? Professor Melinda Mills, social distancing, this is a question from Sue. She says, previously under COVID alert level 4, social distancing was in place. Is this the case now? And if so, why are people not being advised they should be social distancing? Are people still social distancing, whether it is in the regulations or not, I wonder? Just subconsciously, I certainly feel that when I'm out and about, I step back when I talk to people. I don't stand as close to people as I used to. Has there been a change in society and how we interact with people?
Yeah, so we looked at multiple self-reported surveys, but also CCTV data reports about that. And what we saw over time, when particularly in July, when the message was given out that there could be a relaxation of some of the restrictions and some of the interventions, and we definitely saw a drop across all things. People were encouraged to go back to work. We saw a drop in face coverings and also social distancing. So I think those kind of are really quite important that people now understand, and there has to be some more clarity in messaging, because people, need to know, okay, well, what do I need to do? Which setting is it in? Why is that new? And why would I need to do this? And as soon as you clarify this, and I think Chris Whitty has said it on multiple occasions, as soon as people understand, why they need to do it and the urgency of it, they will do it. But I think Sue's raised an important issue, that there has been sometimes a lack of clarity. We can think about face coverings, for example, when they were only in certain spaces, such as transport or in shops, and people started to wonder, well, why not in this space and not in another? So I think in clarity of communication will be another important thing, particularly as we go into the holiday period.
So do you think more government messaging would be useful? Because it does perhaps feel quite a while since the hands, face, space logo was foisted upon us repeatedly. We don't sort of hear any of those messages anymore, do we?
Well, I think also the science has evolved, and it's not that people have been incorrect, but there's a clear understanding now, transmission via aerosol transmission and droplets. So ventilation really has to enter into that factor as well. And also that idea about social bubbles that we all, grew to understand, that you should have repeated contact within the same networks of people over the period, that you should make sure you open the windows because it's a winter period now. And, all of that messages, I think, it can't be repeated enough. And as soon as people hear it and they understand and they have some control and know what they need to do, people will generally, understand that and adhere to it.
OK. Another question from a viewer concerned about their safety, Dr. Nagpaul. This is from Anne, and she says, my daughter's partner had COVID 2 weeks ago. He's well now and has antibodies. She has an autoimmune disease, rheumatoid arthritis. Is it safe for her to spend Christmas Day with him, or could he still transmit the new variant to me? There's a lot resting on this answer, Dr. Nagpaul.
Sure. Well, if he's recovered from COVID 2 weeks ago, of course, it could have been the Delta variant, and he may still be therefore susceptible to getting infected with Omicron. Now, I think that the important point is that those who suffer with autoimmune conditions or have any other vulnerable medical condition that places them in a vulnerable position should be taking extra precautions now, not wait till when you meet someone at Christmas, but now. I said that earlier that you should wear a medical grade mask, an FFP2 mask, so when you go out, to prevent yourself becoming infected, protecting you as a wearer, but also being very careful about mixing. I think by taking those measures, you reduce the likelihood of being infected and possibly transmitting it on to loved ones at Christmas. The other thing that, and I totally agree with Bharat, that there are limitations on lateral flow tests, but if they can be done properly, and it does mean watching a YouTube video as well as reading the instructions, they can be done properly and they're done sequentially. There is a pickup rate that if you are an asymptomatic carrier, it will show that you may be infected. And taking those precautions before you meet your loved ones at Christmas is important. The third is how you meet people. It's not just about meeting. You can meet people in a crowded room at Christmas, in a crowded living room, or you can meet with a good ventilation, which makes a huge difference to the risk of transmitting the virus, and also with more spacing out and having just fewer people in the room. So there are those measures that will also reduce the risk.
So just to summarise for Anne, you're saying that